Welcome to another episode of The Brand Called You, a podcast and podcast show that brings you leadership lessons, knowledge, experience, and wisdom from hundreds of successful individuals from around the world. I am your host, Ashutosh Garg, and today I'm delighted and privileged to welcome a very accomplished banker turned entrepreneur, Mr. Sajid Rahman from Jakarta, Indonesia. Sajid, welcome to the show.
Thanks, Ashutosh. It's a pleasure.
Thank you. Sajid is the co-founder and CEO of Digital Healthcare Solutions, an organization that is part of the Grameen Group. He's a partner of MyAsia VC, which is a venture capital fund. He's a former banker with Standard Chartered. He's a board member with several organizations. He writes for several publications. And interestingly, he's a runner of marathons. Wow, what an amazing profile you have, Sajid. So Sajid, let's first talk about digital healthcare solutions. Tell me about this venture.
So it all started as part of Telenor Group. Telenor, as you know, is a Norwegian telco with big presence in South Asia and Southeast Asia. They own a majority stake in one of the largest telco companies in Bangladesh called Grameen Phone. So Telenor wanted to launch a healthcare business to serve essentially their customer base, which is around 70 million in Bangladesh.
Right.
And they were looking for someone who has experience of building a startup within a corporate, because the whole idea that it would be a separate company, operate like a startup, from scratch, build the whole platform. So that's, they brought me in to build the whole Telenor Health thing. And then at some point, the Telenor Health got so big that, they wanted to get a partner who actually understands healthcare better.
Okay.
Because Telenor is mostly a telco.
Right.
So that's where the Grameen came in and took it from Telenor Health to under Digital Health. And we rebranded it as Digital Healthcare Solutions.
Okay.
Mostly started as more like access to healthcare for people who otherwise won't have it. So build a digital platform on top of the telco network. That's how it all started. So access to quality doctor consultation, medicine and prescription, medicine delivery, video consultations, audio consultations, stuff like that.
Okay.
But then we expanded the whole thing into other places. So, we connect these healthcare solutions with clinics, hospitals, medical colleges, nursing colleges. We are now trying to create an end-to-end healthcare solutions for individuals across emerging markets with a big health financing component, because most of these countries struggle to have good health insurance programs.
Very interesting. And this is predominantly in Bangladesh, or is it in other countries as well?
It is currently only in Bangladesh.
Okay. And are you planning to expand it to other countries?
Definitely, yeah. So, currently we serve 5 million people in Bangladesh. So it's quite a scaled operation.
Yeah.
And now that the model is proven and we think that it can scale in a positive economic underlying factors, we are now looking to expand in other markets. So we'll probably look at similar demographics like Bangladesh.
Very interesting. So my question to you when I was reading about you was that telemedicine has been in existence for the last three and a half decades when VSATs came into the world. How is your offering different in terms of a digital hospital as compared to telemedicine?
So the way it's different is, it's just not one-off consultations that we usually know where, person calls the doctors and get it. It's essentially the reason we call it as a hospital, because it wants to digitize the whole hospital offerings. So from a consultation where actually electronic medical record is created of the individual, then the electronic medical record data is used to prescribe medicines, connected to pharmacists to deliver medicines to the individuals. If any item is required, let's say diabetics, measurements or anything like that, that can be bought from the hospital like a marketplace. And then, of course, the big thing is that one of the challenges we find in teleconsultation, it's good for primary care, but it's not so good for secondary or tertiary care. That's where the physical intervention is to come in. And that's why we connect the individual patients to clinics and hospitals, so that the healthcare journey continues and the data flow continues with the patient.
Very interesting. So tell me, in the 5 million people that you are currently serving or servicing in Bangladesh, what are some of the health challenges that you seem to be addressing?
So it's very typical of probably a lot of South Asian countries. So diabetes is a big challenge in case of Bangladesh. Hypertension is a big issue.
Okay.
Cardiac problem is a big issue. We are seeing quite a few challenges in maternal and childcare. So some of the disease, some of the things that probably cannot be discussed or not probably very comfortably discussed by female patients, the doctors. So they are more comfortable discussing it over phones with the lady doctors. They can choose that. So we are seeing that. One area which we didn't anticipate that much, but we are seeing a big issue is mental health. Wow. So we are, especially during the COVID time, we are seeing a surge in call of mental health consultations. And that's one of the reasons we actually trained our doctors who received the calls to also have some training in mental health. So they had to go through that curriculum.
What you're saying is so fascinating because if I can use our part of the world, I'm just taking you as someone from South Asia. Mental health is something that is not normally spoken about. But over the last five or 6 years, I'm beginning to see people are willing to talk about it. So I think that's a very positive kind of a move that's happening.
True. There was a stigma around that, but I think, people are becoming more aware of the challenges.
So one more question on healthcare before I move to the next segment. In the event of a severe or an emergency case that comes up through your digital solution, do you rush patients to, the tertiary hospitals or some of the other hospitals? Or?
Yeah. So the way it works is that, so the challenge is that, when you're doing telehealth or digital health over phone or video, and when you do it at scale, we have a very clear protocol which doctors follow. So this is based on the Cleveland protocol on the same model. So what happens is that the doctors are very clearly, whenever they're seeing and we are seeing a lot of cases where someone has a chest pain and calling, and if the doctor is anticipating that it might be a cardiac arrest, they immediately refer to the nearest hospitals. And what is good is that the doctor can see where the patient is located and where is the nearest hospital is. So, so they can connect that. So that is getting quite helpful.
Fascinating. So now let's move to the next part of our conversation. It's about Tonic. And I love the name, which is one of the first digital offerings in Bangladesh. So tell me, what areas of healthcare does this brand operate in?
So the Tonic started essentially during Telenor Health days, mostly focusing on Grameen customers. Okay. So because Grameenphone has a large customer base, so Tonic was our first consumer-facing brand that we launched, and that was essentially a package where a person pays a very small amount, depending on which packages the person wants, and can get different types of coverage. So a simple 49.50 taka, which essentially translates to 70 cents per month. A person will get 10 minutes of discussion, free call with a doctor, will get roughly $20 worth of insurance coverage to buy medicine and stuff, and sometimes the free content, i.e. how to live health and well-being. So it was there were different packages for family, individual, stuff like that. So that was the whole idea of Tonic, where a person can get very quality healthcare and a package at a very affordable price. And the interesting thing about it is, I don't know, in many countries, a lot of telco products are sold on prepaid cards. Correct. Right? People buy these cards and top up. Yeah. So we use that same cards to sell Tonic packages.
Wow. So, fascinating. I've always marveled at how innovative solutions are coming, are in Bangladesh. I mean, full marks to you. And I've been there a few times. It's incredible. So, Sajid, when I was reading about you, I also noticed that you said Tonic serves as a gateway towards universal health coverage. Help me understand how this happens.
So what happened is, one of the challenges we found is that, the access to quality healthcare or universal health coverage was the issue of two. One is obviously pricing. So we wanted to make it very affordable at very low cost. And then, of course, the question of how do we make sure that the cost of treatment is covered. So one of the things that we did very interestingly with Grameenphone is that because they are the largest telco provider with 70 million, and we said, all Grameenphone customer who wants to opt in, because there is some data transfer, so it has to be opt-in, they can get the whole thing for free.
Mm-hmm.
So the whole idea was that we bring this whole huge customer base of 50, 60 million under, which is, the total country is 130 million. So that's almost half of the population under this coverage and provide it for free. So that was the plan.
Phenomenal. And one more question, and this is about the young people. I mean, most of the countries in Asia, South Asia, have a very young population. Mm-hmm. And I've often said, I'm 65 years old, but I've often said that my generation seems to have messed up the world, but the millennials are changing it and hopefully will do good for the world. How are the millennials and the Gen Zs changing the landscape of healthcare in Bangladesh?
I think three ways we're seeing them. So one is we are seeing a lot of millennials and Gen Z. They're very, they really like to work for mission-driven companies. So they want to volunteer, even if they don't get a job, they want to volunteer for those companies. Right. And we are seeing a lot of mission-driven Gen Z millennials working for us. In fact, I have the oldest guy in the team. There's a lot of very young people, from coders to commercial to marketing. So a lot of them are part of the team. So that's one. The second thing we are seeing is a lot of them are actually opinion makers. So, so in many cases, the older family member, we unwilling to take a digital health offering. The young are the ones making the decisions for them, for their parents, for their grandparents, and, persuading them to take this advantage because it's very, convenient for a lot of them. So they're big. And the third thing I'm seeing, which is sort of like a lot of them are actually building solutions. So they have a big entrepreneurial, mindset. So a lot of the young population are actually working on building healthcare solutions in Bangladesh.
Wow, that's amazing. So now let's move to the third part of our conversation, which is about MyAsia VC, which is your venture capital fund. Tell me a little bit about the fund and some of the areas that you focus on.
So, it all started for me, during my banking days and later in healthcare, sort of like, put in small amount of money from my salary into different startups because I thought, the ideas look very interesting. So that's how it started. I ended up investing in, almost 1,000+ companies across the world, mostly from Silicon Valley and that part of the world, but also quite a few from Southeast Asia and South Asia. The focus essentially are three things. So my first observation of working in Africa, in different countries in Asia, is that all countries are on the same digitization curve, but at different points. So we are seeing business model that has already been proven in US are being migrated in Asia. Business model that has already been proven in India are being migrated to Indonesia, right? So the model risk is very low. It's more of the execution risk. So to find those companies and invest in them before they break out. So that's one of the thesis we have. And the second thing is a bit out. It's very much out in the left. Is purely groundbreaking companies. So I invested in companies which works in Hyperloop, the one that Elon Musk envisioned. We invest in a lot of CRISPR companies. We invest in a company which is called Caribou Bioscience. So it's by Toda Nashi, won Nobel Prize for the first year, coming up with the CRISPR, solutions. Right. So we do a couple of those very, very out there companies, and just to get a front row seat of how things are developing.
Wow. And you also say that you have an enviable track record with 15 unicorns and 20 startups with the value that you have is over $100 million. So tell me about one or two of your interesting investments that became unicorns.
So the number, obviously, I think the good thing is, the whole world is now, on an upsurge, right? Given the low interest rate and everything. So the pricing, so we are pretty much saying, one or two unicorn every month within the portfolio. So the number has significantly changed, but quite a few. So one is, which would be interesting to, there's one company which is in Indonesia. So they are building a payment platform, almost like Stripe, but for Southeast Asia market, so built on that hypothesis. So they just became a unicorn a few months back. So it's a huge business doing the Stripe thing. There's one company which I don't know whether, so they are building supersonic jet, but unlike Concord, it will be very affordable. So, so they're being mass, transportation at that speed, but very affordable price. There's one company which is working in cloud data security, so that's a big space and, highly successful. There is one company, there are many companies in e-commerce space, which are become unicorns. So, so what we are seeing is companies that have really executed well, enjoyed a significant valuation uptick in the past months.
Wow. So, you just mentioned that you, from your Standard Chartered Bank days, you invested in over 1,000 startups. And therefore, logically, I can make a statement that Sajid Rahman is a startup investment guru. So my question to you, Sajid, is that based on your experience, what are some of the basic mistakes a lot of startup founders make?
So I think, there are a couple of things. And, I see, because I invest across geographies, so not in, across emerging markets, from Brazil to, Vietnam to, US to Bangladesh. And I think the mistake is a bit different country to country. So, so in an emerging ecosystem like Bangladesh or Indonesia and others, we are seeing founders sometimes do not have enough mentor, advisor around them to really help them understand the mistakes. So that's one of the challenges. And sometimes, the founders overspend. So, one of the things the founders forget that, valuation will always come in, but the question is, how do you spend that money, to go to the next level, right? So what I've seen founders raising fund and then misusing it, not doing it properly. So that's one of the, challenges. Some founders, are very slow at making people changes. Probably that's something which comes with experience. So, if you do a wrong hire in a small company, that can be very expensive, right? In a large company, yes. I mean, a wrong hire may not impact the whole company future, but in a 10 people company, that's a big problem, right? So some founders are too slow to make those changes. So that's one, or that's two. And then, of course, the whole idea of trying to do too many things at the same time. So, this very famous thing from Airbnb founders is that do things that don't scale, which is contrarian of what we usually think. But the idea is that if you really find that sweet spot, it automatically will grow. But, we are seeing founders trying to do 10 different things, because I guess the founders are so, so optimistic about the future and about them. So they want to solve every solution, right? So which sort of creates a dilution in focus and challenges for the company.
Oh, fascinating. When you were speaking, I was almost taken back to my own journey as a startup founder, and I'm doing something similar even now. But my next question to you, Sajid, and I have time for two more questions. Given the number of startups that you work with, how involved do you get in governance of these startups?
So not in most of the cases, right? So most of the cases is just because, given the number, because these are very early stage investments. So these are seed stage investments. So we just, invest and sort of like invest and forget sort of thing. Because, usually the people taking board seats or governance are people who takes a much more majority stakes or, mostly institutional funds, leading around. So I don't get involved, right? But few companies like Zendit, where I was an advisor to the company in early days. So there, it's not so much of governance, but more of trying to, talk with the founders on developing design of the products or the market. Or in some cases, let's say founder reach out to me if I can make a couple of introductions, for the next level of investors and stuff. So we do that.
Fascinating. And my last question to you, as an investor, at what stage do you look for an exit?
So I'm, so one of the things I get, because, I've been doing this for some time now, so I'm already getting a lot of offer for secondary sales, right? So new investor come in and say, do you want to sell your stake? But I really like to see to the end. So unless the company does a, IPO or get acquired, I usually hold it. So, which can happen in 3 years time, which can happen in 7 or 10 years time. So it depends, but I usually try to, go through the whole journey and see where it ends up.
So I've got to ask you one more question, and I often ask this from a lot of people who invest. Tell me about one or two of the ones that got away.
Oh, many, many. I recall I don't know whether you know, there's a company called Coinbase, which
Yeah.
was IPO'd at I think at 90 billion valuation, right?
Mm.
So when Coinbase was $200 million company, I got an opportunity to invest, and I thought, how big can this be? I don't know, guys, this might be maximum $500 million or $1 billion company.
Right.
So my 200 million would be a 3x, 4x, because I write small checks. I need a 10, 20x, but then ended up becoming a $90 billion company, right? So there are many like that, which I missed.
I know that's always a regret with a lot of people, but then you also make so many other investments. But on that note, Sajid, thank you so much. It's been such a pleasure speaking to you. Thank you for taking me down two amazing journeys that you seem to be going through simultaneously. One is the incredible ramp up of healthcare in Bangladesh. And the second is your amazing journey as an investor. Thank you again and good luck.
Thank you. Thanks, Sajid. It was a pleasure. Thank you.
Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the Brand Called You.